Crowdsourcing turns complicated tasks into a series of simple tasks completed by a large number of people. This increased simplicity allows people who lack expertise to assist in complex problem solving, such as creating predictive algorithms. One of the key differences between crowdsourcing and traditional employment are the low skill requirements and independence of the workers. I think these differences are problems that need to be addressed. The disorganization of labor and the reduction of skilled labor will place workers at risk of being exploited. Even the idea of independence can be problematic since these workers wouldn't obtain benefits of standard labor, such as healthcare. While I think that advancements in algorithms is important, we need to consider the social implications of the methods we employ. Ideally, we'll continue to benefit from the collective intelligence and work provided by crowdsourcing while protecting those who participate. One way to improve these problems is to employ crowdsourced workers as standard employees.
With crowdsourcing gaining popularity, it is being used to solve problems in all different types of fields. However, there are still many issues with crowdsourcing systems which can be worked on. First, we would need to do research to improve the accuracy of the inferences. Therefore, there would need to be more fine-grained inference methods. In addition, instead of focusing on binary labeling, multi-class labeling should be studied so that we can reduce the sparsity of data and labels. Another thing to improve is improving the quality of learning models in a cost-effective way. There is also still a great amount of uncertainty when it comes to crowdsourced data, which makes it difficult to answer theoretical questions that we're trying to solve with crowdsourcing. Within the past 10 years, there have been many improvements in algorithms that have been created, and I think that if this can occur within 10 years, even more improvements can be made within a short amount of time as well.
Hello, my name is Ollie, and I'll be talking about an application of crowdsourcing data specifically relating to the opioid hackathon that we all did. So on track 5, we were given the task to use data, and that could be either from Socrato or through crowdsourcing. And if you do it through either of these means, then you'll have data that comes from all sorts of sources, which is crowdsourcing. And with that, the data comes to you, but you don't have any control of what kind of data it is. It's either going to come to you crude, it's going to come to you age-adjusted, and that's something that can be improved upon in the future with you can filter out what kind of data that you want so that you can specifically target and predict correctly. For example, for my hackathon project, we did financial indicators, and in finances, there could be a leading on based on age, and it could be more biased also based on race or ethnicity. So the two fixes for that would be to use age-adjusted rates, and that would fix the age problem. Another one would be to use race or ethnicity-adjusted rates so that those are taken into account of and not confounding factors in the data themselves.
Hello everybody, my name is Maha, and I will be going over the article about the bias against Black patients in healthcare due to the prediction algorithms that are used in healthcare. So this article talks about how algorithms that are used in healthcare are biased against Black patients, mainly due to the inequalities that already exist within our healthcare system. The root of this problem is the privatization of healthcare. Algorithms in healthcare are created by private companies, so it makes it difficult for data scientists and researchers to inspect these algorithms. After conducting an analysis at an academic hospital that was using a risk-based algorithm, researchers found that Black patients had poorer health overall than white patients. The algorithms identified need for healthcare based on money rather than actual health, causing this disparity between Blacks and whites in our healthcare system. However, these algorithms can be adjusted to account for more reliable factors to decrease this bias and help bridge the gap between Blacks and whites in our healthcare system.
Hi everyone, this is Patricia from Group 19, and today I'm going to talk about the second article, specifically disparity in healthcare. As mentioned by my group members, the disparity in healthcare is high, and the lack of unbiased healthcare prediction algorithm only enhances this issue. Reading this article reminded me of another study by Schulman et al. Regarding treating Black patients with a different treatment standard for cardiovascular disease or CVD. The findings of the study suggested that doctors recommend more gold standard of treatment to white males as compared to black males with similar health outcomes. I think it is important to not only rely solely on either algorithms or physicians, as they can have their own biases, but to combine both in order to deliver better health care quality. The current algorithm finds sick patient based on which patient the hospital spent most money on. But I think a better way is to use a biological detector to base the level of sickness of patients on physiological sense. Thank you.